Hi, this is Dr. Chad Woolner with Align Chiropractic and Rehabilitation. I want to share with you in this video a real common culprit behind persistent nagging TMJ pain. And unfortunately, this problem doesn't get addressed very often by physicians. Sometimes they'll see TMJ problems and they won't even address this particular issue. And so I want to share with you exactly what it is today. Sorry, this image, hopefully it's not too scary here, but I'm going to show you on this image here. Right here, obviously, you're looking at the TMJ. Deep inside, you have what are called your pterygoid muscles. And these pterygoid muscles are largely responsible for movement of this jaw and stabilization of the jaw. A lot of times what's happening with TMJ patients that have a lot of this persistent pain and headaches because of it, you have irritation of that pterygoid muscle and also irritation of this muscle here, your temporalis. Okay, so when you kind of clench down your jaw and you feel kind of the sides of the head, this muscle kind of bulge out, that's the muscle we're talking about there, is the temporalis. So a lot of times what will happen with TMJ problems is these muscles will be tight and irritated and in spasm, and you really need to address those, because if they're not addressed, that's kind of the root cause of what's causing a lot of that. And so one of the ways to assess this is we'll sit down with a patient, we'll actually have them just open and close their jaw and take a look at the movement. And a lot of times it's subtle, but it is pretty simple to detect if there's an imbalance, because what you'll essentially see is a little bit of a lag between side to side. You'll see one side that'll drop a little bit faster than the other, and then the other side will kind of catch up. So essentially, if you're looking, let's rotate this again here. If you're looking at the jaw from the front and they open the jaw, what essentially you'd see is one side would dip down a little bit quickly before the other, and then the other side would kind of catch up. And essentially what that is telling us, one of the things that it could be telling us, is that there's a muscle imbalance, that pterygoid muscle on that side and that temporalis on that side is a little bit tighter and in spasm, and is causing a little bit of a biomechanical restriction there, not allowing that side of the TMJ to move as freely as the other side. And so that's something, if you've had TMJ problems, take the opportunity, take a look in the mirror, open your jaw nice and slow, close it, do that a couple times, see if you can notice a difference between side to side, and a lot of times you will. You'll see a difference, and that is one of the key culprits there is that pterygoid muscle and that temporalis muscle. And so there's a number of things that we do to treat TMJ problems, and we get great results when we treat our patients. We do a couple soft tissue therapies. We also use what's called low-level laser or cold laser, which gets great results with TMJ, among other things. And then we also do very gentle mobilization of that TMJ joint itself, and that gets great results. And so in addition to that, we also evaluate all of the other surrounding joints, the cervical spine. A lot of times you get compensatory problems in the neck, and so we address those issues as well, and we try and take a very comprehensive look at things and approach it from that perspective. And so if you have TMJ problems or know someone that does, we've gotten great results helping a lot of patients with TMJ issues, and we're confident that we can help you out as well. So give our clinic a call. Our phone number is 208-639-1397. We look forward to hearing back from you, and we look forward to helping you. Thanks.